Good evening everyone. I am Dr. Prudwiraj, consultant endocrinologist and diabetologist at Arete Hospital, Gachibowli, Hyderabad. Now I am going to demonstrate how the insulin pen has to be injected. Many of the diabetic patients are on insulin and they are not aware about the right technique they are taking. So hope this video helps you in taking your insulin. There are 3 precautions you have to take before taking your insulin. One thing is make sure whatever the insulin prescribed by a doctor, the name is matching on the insulin pen which you are taking. And the second thing is see the expiry date of the insulin pen which you are taking. And there are 2 types of pens in insulin pen. One is the reusable pen and second is a use and throw pen. You can take any kind of insulin pen as per your convenience. The third important thing is you have to keep this insulin pen at store at a temperature of 2 to 8 degrees in the refrigerator door. You cannot keep it at extreme cold and extreme heat temperatures. Do not store it in deep fridge or keep on top of the fridge. Make sure you are storing the insulin pen in the insulin fridge door only. And whenever you have to take your insulin shot, take the insulin out of your fridge door and leave it in the room air temperature for 2 minutes to come into the temperature of 15 to 30 degrees. If you don't have that much time, you can keep the insulin pen in your hands and roll it for 10 to 15 times to make sure that insulin comes from fridge temperature to the room temperature. Once you are done this, you need all the equipment to take your insulin shot. You need your insulin pen, you need the insulin needle, pen needle, and you need an alcohol swab to clean the insulin injection site. And you have to rightly choose your insulin injection site. You have to take it, preferably take it on the abdomen where the error rate is little bit low. You can take it on your front of your thigh part also, but avoid the arm part to self-inject because the chance of error is little bit high when you take it on your arm. And once you decided to take your insulin shot, the insulin pen contains, as you can see, a button plunger, and it contains visible numbers. The units how much you have to take will be prescribed your doctor, and you have to keep that number here by rolling this plunger. And there is a cap for the insulin pen. Once you open the insulin pipe, the cartridge is readily visible. In a reusable pen, this cartridge can be replaced. In a use and throw pen, the cartridge is fixed, and once this cartridge is finished, you have to throw the pen. And you will have a side to fix your needle on top of the insulin pen, and insulin pen needle has to be opened. This cap has to be opened gently and the needle is visible, and you have to fix this insulin pen needle into the insulin pen gently. You have to make sure it is fixed tightly, and after fixing it tightly, you have to remove the cap of the insulin needle. There will be 2 caps. After removing the first cap, you can see the small second cap, and after opening the second cap, you can see the small needle. And to make sure there is no air bubble, tap it couple of times, and whatever the air if you seen in the insulin pen that comes onto the top, and roll the plunger to the one and press the button to discard the air bubble. And as you can see, the insulin drop on top of the needle. It is safe to inject. Then whatever the dose you have to take, you have to roll the plunger. Now I am rolling the plunger to the 6 to inject the 6 units of insulin. And once the right amount of insulin is set, you have to hold the insulin like a pen. Don't put a finger on the plunger before only. And you have to clean your insulin injection site. And once you choose the insulin injection site, hold it slowly and directly push the insulin in 90 degrees to the insulin injection site, and you have to press the button with your index finger. You can hear the clicks actually, the right amount of clicks you can hear. And after the clicks are finished, you have to wait for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. After counting to 10, you can remove the insulin pen, and again you have to cap the insulin needle, and you have to remove the insulin needle from the pen. Ideally, one needle has to be used only once, and you have to cap the insulin again, and you can store it back in your insulin fridge door. And again, for the next time insulin injection, you have to repeat the cycle again.